Question 1. Process analysis reveals that a client is seeking assistance for their dog's persistent barking at the mail carrier. The client expresses frustration and suggests using a spray bottle filled with water and a loud no command, believing this will quickly deter the behavior. The dog is otherwise well behaved and has no known health issues. The trainer has assessed the situation and understands that the barking is likely rooted in territoriality and excitement, rather than aggression. Considering the CPDTKA's emphasis on humane and effective training, what is the most appropriate course of action for the trainer? Option A. Inform the client that barking at the mail carrier is a natural dog behavior that cannot be effectively changed, and suggest management strategies like keeping the dog in another room during mail delivery. Option B. Advise the client that the dog's behavior is a sign of dominance and recommend a training approach that involves firm corrections and establishing clear pack leadership to assert control. Option C. Explain to the client that while the suggested method might temporarily suppress the barking, it does not address the underlying emotional state of the dog and can lead to negative associations. Instead, propose a training plan focused on positive reinforcement to build a positive association with the mail carrier's arrival and teach an alternative, incompatible behavior. Option D. Agree to use the spray bottle and loud commands as requested by the client, as this is a common and often effective method for immediate behavioral suppression. The correct answer is C. Explain to the client that while the suggested method might temporarily suppress the barking, it does not address the underlying emotional state of the dog and can lead to negative associations. Instead, propose a training plan focused on positive reinforcement to build a positive association with the mail carrier's arrival and teach an alternative, incompatible behavior. Explanation. This scenario presents a common challenge in dog training, balancing a client's perceived needs with evidence-based, ethical training practices. The professional dog trainer must navigate the client's emotional investment in their dog's behavior and their preconceived notions about training methods, while adhering to the Certified Professional Dog Trainer Knowledge Assessed (CPDTK) standards, which emphasize humane and effective techniques. The core challenge lies in educating the client about scientifically supported learning principles and demonstrating how these principles lead to better welfare and behavior modification outcomes, without alienating the client or compromising the dog's well-being. The correct approach represents best professional practice because it prioritizes the dog's welfare and employs scientifically validated training methods. This aligns with the core tenets of the CPDTKA, which advocates for positive reinforcement and avoidance of punishment-based techniques that can cause fear, anxiety, or aggression. By focusing on understanding the underlying motivations for the dog's behavior and implementing a plan based on positive reinforcement, the trainer is acting ethically and professionally, promoting a strong human-animal bond and long-term behavioral success. This approach also demonstrates a commitment to continuing education and evidence-based practice, which are hallmarks of a certified professional. An incorrect approach that relies on aversive methods, such as shock collars or harsh corrections, represents a significant ethical and professional failure. Such methods can inflict pain and distress on the dog, potentially leading to a breakdown in the human-animal bond, increased fear or aggression, and suppression of behavior without addressing the root cause. This directly contravenes the principles of humane training and the ethical guidelines expected of a CPDTKA certified professional. Furthermore, recommending or using such methods could be seen as negligent if it leads to harm or exacerbates the behavioral issue. Another incorrect approach might involve dismissing the client's concerns or imposing a rigid training plan without adequate assessment or client buy-in. This fails to acknowledge the collaborative nature of training and the importance of client education and participation. A professional must be able to communicate effectively, explain the rationale behind their methods, and tailor plans to individual client and dog needs. Failing to do so can lead to client dissatisfaction, noncompliance, and ultimately, a less successful outcome for the dog. The professional decision-making process for similar situations should involve a thorough assessment of the dog's behavior, environment, and the client's goals and capabilities. This assessment should be followed by clear, evidence-based communication with the client, explaining the chosen training theory and its application. The trainer should then collaboratively develop a training plan, ensuring the client understands their role and the expected outcomes. Continuous evaluation of the dog's progress and adjustment of the plan as needed while maintaining open communication with the client, are crucial for successful and ethical dog training. Question 2. Stakeholder feedback indicates that a client is expressing frustration with the pace of progress in their dog's training, suggesting the trainer should incorporate more firmness and immediate corrections to achieve faster results. The trainer has been employing positive reinforcement and desensitization techniques based on established principles of associative learning. How should the trainer ethically and professionally respond to this client feedback while adhering to best practices in dog training? Option A. Suggest that the client research alternative training methods online that may align better with their desire for quicker results, implying that the trainer's current approach is not suitable for their needs. Option B. Explain the scientific basis of positive reinforcement and associative learning, detailing how these methods promote long-term behavioral change and a strong human-animal bond, while also outlining a revised plan that incorporates achievable milestones and addresses the client's desire for progress within ethical boundaries. Option C. Agree to incorporate some firmness and immediate corrections as requested by the client to demonstrate responsiveness and potentially speed up the training process, even if it deviates from the trainer's preferred methods. Option D. Politely dismiss the client's feedback, stating that the current methods are the only scientifically valid approach and that the client should trust the trainer's expertise without question. The correct answer is B. Explain the scientific basis of positive reinforcement and associative learning, detailing how these methods promote long-term behavioral change and a strong human-animal bond, while also outlining a revised plan that incorporates achievable milestones and addresses the client's desire for progress within ethical boundaries. Explanation. Scenario analysis. This scenario presents a professional challenge because it involves a conflict between a client's perceived success and the trainer's ethical obligation to employ humane and scientifically sound training methods. The client's satisfaction is important for business, but it must not supersede the welfare of the animal or the integrity of professional practice. The trainer must navigate this delicate balance, ensuring that the dog's well-being and the application of ethical learning principles are prioritized, even when faced with client pressure. Correct approach analysis. The correct approach prioritizes the dog's welfare and adheres to the principles of associative learning by focusing on positive reinforcement and avoiding aversive stimuli. This aligns with the ethical guidelines of professional dog training organizations that advocate for humane treatment and evidence-based practices. By explaining the scientific rationale behind the chosen methods and their long-term benefits for the dog's behavior and the human-animal bond, the trainer upholds professional integrity and educates the client. This approach fosters a collaborative relationship built on trust and shared understanding of the dog's needs. Incorrect approaches analysis. One incorrect approach involves yielding to the client's demand for faster results through potentially aversive methods. This fails to uphold the ethical responsibility to avoid causing unnecessary fear, pain, or distress to the animal, which is a fundamental tenet of professional conduct and often implicitly or explicitly covered in professional codes of ethics. It also undermines the principles of associative learning by potentially creating negative associations with training or the handler, leading to unintended behavioral consequences. Another incorrect approach is to dismiss the client's concerns entirely without offering a clear, evidence-based alternative. The trainer's methods may be scientifically sound. A lack of empathetic communication can damage the client relationship and lead to the client seeking less ethical or effective training elsewhere. This approach neglects the importance of client education and collaboration in achieving training goals. A further incorrect approach might be to implement a hybrid method that includes some aversive techniques to appease the client, even if the trainer is uncomfortable with them. This represents a compromise of professional ethics and scientific integrity. It can lead to a degradation of the dog's welfare and can create confusion in the learning process, potentially hindering long-term progress and damaging the human-animal bond. Professional reasoning. Professionals should approach such situations by first actively listening to and validating the client's concerns. Then, they should clearly articulate the scientific principles of associative learning and the ethical framework guiding their practice, explaining why certain methods are preferred for the dog's long-term well-being and behavioral development. This involves educating the client on the potential negative consequences of aversive methods and the benefits of positive reinforcement. The professional should offer a clear plan that addresses the client's goals within ethical and humane boundaries, emphasizing patience and consistency. If the client remains insistent on methods that violate ethical guidelines, the professional should be prepared to respectfully decline continuing services, explaining that their commitment to animal welfare prevents them from proceeding. Question 3. During the evaluation of a 3-day-old puppy exhibiting lethargy and a lack of appetite, what is the most appropriate course of action for a certified professional dog trainer to recommend to the owner? Option A. Suggest specific home care remedies and temperature adjustments based on general neonatal care guidelines. Option B. Advise the owner to immediately consult a veterinarian for a thorough examination and guidance. Option C. Provide advice on a specialized puppy milk replacer formula and feeding schedule without veterinary consultation. Option D. Recommend observing the puppy for another 24 hours to see if the symptoms resolve on their own. Correct answer is B. Advise the owner to immediately consult a veterinarian for a thorough examination and guidance. Explanation. This scenario presents a professional challenge because it requires the trainer to balance immediate welfare concerns for a neonatal puppy with the owner's understanding and capacity to provide appropriate care. The neonatal period is a critical developmental stage where puppies are highly vulnerable to environmental factors, disease, and improper handling. A trainer's advice must be grounded in established best practices for neonatal care, which often involve specific temperature, hygiene, and feeding protocols, and must also be delivered in a way that empowers the owner without causing undue alarm or suggesting the trainer is acting outside their scope of expertise. The correct approach represents best professional practice because it prioritizes the puppy's immediate health and safety by recommending consultation with a veterinarian, who is the ultimate authority on medical diagnosis and treatment. This aligns with ethical guidelines for professional dog trainers, which typically stipulate that trainers should not provide veterinary advice or diagnoses. By directing the owner to a veterinarian, the trainer is acting within their scope of practice, ensuring the puppy receives appropriate medical attention and fulfilling their duty of care by facilitating access to qualified professionals. This approach also educates the owner on the importance of veterinary involvement in critical developmental stages. An incorrect approach that involves the trainer attempting to diagnose the issue and prescribe a specific home remedy, such as suggesting a particular feeding supplement or temperature adjustment without veterinary input, represents a significant regulatory and ethical failure. This constitutes practicing veterinary medicine without a license, which is illegal and unethical. It bypasses the expertise of a veterinarian, potentially delaying crucial medical intervention and leading to adverse outcomes for the puppy. Furthermore, it erodes client trust and exposes the trainer to liability. Another incorrect approach, such as dismissing the owner's concerns as normal puppy behavior without further investigation or recommendation for veterinary consultation, is also professionally unacceptable. While some neonatal behaviors can be typical, subtle signs of distress or illness can be easily missed by novice owners. Failing to recommend a veterinary checkup when there are any concerns, especially regarding a vulnerable neonatal puppy, is a dereliction of the trainer's duty of care and could lead to a worsening of a treatable condition. This approach prioritizes convenience over the puppy's welfare and demonstrates a lack of due diligence. The professional decision-making process for similar situations should involve a clear understanding of the trainer's scope of practice, which is focused on behavior and training, not medical diagnosis or treatment. When presented with concerns about a puppy's health, particularly during the neonatal period, the immediate and primary recommendation should always be to consult a veterinarian. Trainers should be equipped to recognize signs that warrant veterinary attention and be able to communicate this recommendation clearly and empathetically to the owner. This involves active listening, acknowledging the owner's concerns, and then guiding them towards the appropriate professional resources. Question 4. The evaluation methodology shows a client seeking assistance for their dog's persistent barking when left alone. The client reports the barking starts within minutes of departure and continues for extended periods, causing neighbor complaints. The client has tried leaving the dog with toys, but the barking persists. The trainer observes the dog pacing and exhibiting other signs of distress during brief separation trials. Which behavior modification approach is most aligned with professional ethical standards and best practices for addressing separation-related barking? Option A. Advise the client to ignore the barking, believing the dog will eventually stop if it doesn't receive attention. Option B. Implement a desensitization and counter-conditioning protocol to gradually increase the dog's tolerance for alone time, combined with management strategies to prevent the barking from occurring during the training process. Option C. Utilize an electronic bark collar that delivers a static correction whenever the dog barks, aiming to suppress the vocalization. Option D. Introduce aversive stimuli, such as loud noises or startling devices, whenever the dog begins to bark to create a negative association with the act of barking. Correct answer is B. Implement a desensitization and counter-conditioning protocol to gradually increase the dog's tolerance for alone time, combined with management strategies to prevent the barking from occurring during the training process. Explanation: this scenario presents a professional challenge due to the need to balance effective behavior modification with the ethical and regulatory obligations of a certified professional dog trainer, CPDT. The core of the challenge lies in selecting a technique that is both scientifically sound and aligns with the CPDT commitment to humane treatment and avoiding harm, as implicitly guided by professional standards and potentially by broader animal welfare legislation that informs ethical practice. The client's desire for a quick fix, coupled with their potential misunderstanding of canine behavior, necessitates a trainer who can educate and guide them towards sustainable, ethical solutions. The correct approach represents best professional practice because it prioritizes understanding the underlying function of the behavior before implementing any modification. This aligns with the CPDT ethical code, which emphasizes science-based methods and the well-being of the animal. By focusing on positive reinforcement and management strategies, the trainer addresses the root cause of the barking anxiety or attention-seeking, without resorting to aversive methods that could exacerbate the problem, cause fear, or lead to unintended negative consequences. This approach is also more likely to result in long-term behavioral change and a stronger human-animal bond, which are hallmarks of professional competence. An incorrect approach that relies solely on punishment, such as using a bark collar without understanding the cause of the barking, represents a significant regulatory and ethical failure. Such methods can suppress behavior without addressing the underlying emotional state, potentially leading to increased anxiety, fear, or aggression. This could violate general animal welfare principles, and, depending on specific local ordinances or professional body guidelines, could be considered animal cruelty or neglect. Another incorrect approach, such as ignoring the behavior with the hope it will stop, fails to meet the professional obligation to provide effective training and guidance. This inaction can allow a problematic behavior to escalate, potentially leading to further issues for the dog and owner, and could be seen as a dereliction of professional duty. A third incorrect approach, involving aversive techniques without proper assessment, also fails to meet ethical standards by potentially causing distress and failing to address the functional aspect of the behavior. Professional decision-making in similar situations requires a systematic process. First, conduct a thorough behavioral assessment to understand the antecedents, behavior, and consequences, ABC analysis, and identify the function of the behavior. Second, educate the client about the assessment findings and the rationale behind recommended techniques. Third, develop a behavior modification plan that prioritizes positive reinforcement, management, and if necessary, counter-conditioning, while avoiding aversive methods. Fourth, monitor progress closely and adjust the plan as needed, always prioritizing the dog's welfare and the client's ability to implement the plan effectively. This structured approach ensures that interventions are humane, effective, and ethically sound. Question 5. Governance review demonstrates a consistent pattern of trainers recommending immediate, forceful suppression of fear-based aggression in young dogs exhibiting growling and lunging at unfamiliar people. This approach is often justified by the belief that such behaviors must be nipped in the bud to prevent them from becoming ingrained. Considering the ethical and welfare implications for the canine, which of the following represents the most appropriate professional response to a client presenting with a young dog exhibiting these behaviors? Option A. Suggest that the owner simply avoid all situations that might trigger the dog's fear and aggression, and hope that the behavior resolves naturally as the dog matures. Option B. Advise the owner to immediately implement strict leash corrections and verbal reprimands whenever the dog exhibits growling or lunging, to establish dominance and deter future occurrences. Option C. Develop a comprehensive behavior modification plan focusing on desensitization and counter-conditioning to gradually change the dog's emotional response to triggers, while implementing management strategies to prevent rehearsal of the aggressive behavior. Option D. Recommend that the owner rehome the dog as soon as possible, as fear-based aggression in young dogs is often too difficult to modify and poses a significant risk. The correct answer is C. Develop a comprehensive behavior modification plan focusing on desensitization and counter-conditioning to gradually change the dog's emotional response to triggers, while implementing management strategies to prevent rehearsal of the aggressive behavior. Explanation. Scenario analysis. This scenario is professionally challenging because it involves a young dog exhibiting fear-based aggression, complex behavior that can escalate if not managed appropriately. The trainer must balance the immediate need for safety with the long-term goal of rehabilitation. Misjudging the dog's threshold or employing inappropriate techniques could worsen the fear, increase the risk of bites, and potentially lead to the dog being surrendered or euthanized. The trainer's decision directly impacts the dog's welfare and the safety of others. Correct approach analysis. The correct approach prioritizes understanding the underlying cause of the aggression fear and implementing a gradual, controlled desensitization and counter-conditioning program. This aligns with best professional practices in canine behavior modification, emphasizing positive reinforcement and avoiding punishment-based methods that can exacerbate fear and anxiety. This approach is ethically sound, as it aims to improve the dog's quality of life and reduce suffering. It also adheres to the principles of responsible dog ownership and professional conduct, which advocate for humane and evidence-based training methods. Incorrect approaches analysis. One incorrect approach involves immediately resorting to aversive techniques, such as leash corrections or intimidation, to suppress the growling and lunging. This is ethically unacceptable as it punishes the dog for expressing fear, which is a communication signal. Such methods can suppress outward signs of distress without addressing the underlying fear, leading to a more dangerous dog that may bite without warning. This approach also violates the principles of humane treatment and can be considered a failure to uphold professional standards of care. Another incorrect approach is to recommend immediate reharming without attempting any behavior modification. A reharming might be a last resort in some extreme cases. It is premature and ethically questionable to suggest it without first exploring and implementing appropriate training interventions. This approach fails to advocate for the dog's welfare and can be seen as an abdication of professional responsibility. It also overlooks the potential for successful rehabilitation with proper guidance. A third incorrect approach is to ignore the behavior, assuming the dog will grow out of it. This is a dangerous oversight. Fear-based aggression rarely resolves on its own and often intensifies with age and continued exposure to triggers. This passive approach is negligent, puts others at risk, and fails to address the dog's suffering. It represents a significant failure in professional duty of care and ethical practice. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the dog's behavior, including its history, triggers, and threshold. This assessment informs the development of a humane, individualized behavior modification plan that prioritizes the dog's welfare and safety. The plan should be based on scientific principles of learning and behavior, utilizing positive reinforcement and avoiding punishment. Regular reevaluation of the dog's progress and adjustment of the plan are crucial. Open and honest communication with the owner about the prognosis and the commitment required is also paramount. Question 6. Regulatory review indicates that effective and ethical dog training practices necessitate careful consideration of praise and reward systems. A certified professional dog trainer is working with a client whose dog, a young Labrador, is easily distracted and shows a strong interest in food. The client is eager for rapid progress and has expressed a preference for methods that yield quick results. The trainer needs to select a praise and reward strategy that is both effective for this specific dog and owner and adheres to professional ethical standards. Which of the following approaches best aligns with these requirements? Option A. Utilize only a single type of high-value food treat, delivered consistently, to avoid confusing the dog with too many options. Option B. Rely exclusively on enthusiastic verbal praise, as this is a universally positive reinforcer for all dogs, regardless of breed or individual temperament. Option C. Focus on a reward system that the owner believes will be most effective, even if it involves methods that are not strictly positive reinforcement, to ensure client satisfaction and perceived rapid progress. Option D. Implement a reward system that primarily utilizes a diverse range of high-value food treats, paired with enthusiastic verbal praise and opportunities for short play sessions, ensuring the owner is thoroughly educated on timing and delivery. The correct answer is D. Implement a reward system that primarily utilizes a diverse range of high-value food treats, paired with enthusiastic verbal praise and opportunities for short play sessions, ensuring the owner is thoroughly educated on timing and delivery. Explanation. Scenario analysis. This scenario presents a common challenge in dog training, balancing immediate behavioral outcomes with long-term welfare and ethical considerations. The professional must navigate the client's desire for rapid progress against the potential for unintended negative consequences of certain reward systems. The challenge lies in selecting a praise and reward strategy that is effective, humane, and compliant with the ethical standards expected of a certified professional dog trainer. This requires a deep understanding of canine learning theory, individual dog temperament, and the ethical guidelines governing the profession. Correct approach analysis. The correct approach prioritizes positive reinforcement and the use of rewards that are genuinely motivating and beneficial to the dog's well-being. This aligns with the ethical imperative to avoid causing distress or harm. Utilizing a variety of high-value rewards, including praise, treats, and play, tailored to the individual dog's preferences, ensures that training is not only effective, but also builds a positive association with learning and the trainer. This method fosters a strong bond between dog and owner and promotes a dog's intrinsic motivation to learn, which is a cornerstone of humane and effective training practices. This approach is directly supported by the ethical guidelines of professional dog training organizations, which emphasize positive, force-free methods. Incorrect approaches analysis. One incorrect approach involves relying solely on verbal praise without considering the dog's individual response or the context of the training. While praise can be a powerful reinforcer, its effectiveness is highly variable and depends on the dog's history, personality, and the specific situation. For some dogs, verbal praise alone may be insufficient to motivate desired behavior, especially in distracting environments or for complex tasks. This can lead to frustration for both the dog and the owner and may result in the dog not performing the behavior, potentially leading to the owner resorting to less ethical methods. Ethically, this approach fails by not adequately assessing the dog's needs and by potentially setting the training up for failure, which can indirectly lead to welfare concerns. Another incorrect approach is the exclusive use of a single type of high-value reward, such as only food treats, without variation or consideration for the dog's satiety or potential dietary needs. While food is often a powerful reinforcer, over-reliance can lead to a dog becoming less responsive to other forms of reward, developing food-guarding behaviors, or experiencing health issues. Furthermore, it limits the trainer's ability to use a diverse range of reinforcers that might be more appropriate for different contexts or behaviors. This approach can be ethically problematic if it leads to a dog's overdependence on food, or if it neglects other aspects of the dog's well-being and motivation. A third incorrect approach involves using a reward system that is not clearly understood or consistently applied by the owner. This can lead to confusion for the dog, inconsistent behavior, and a breakdown in the training process. If the owner is not properly educated on how to deliver praise and rewards effectively, the intended positive reinforcement may not occur, or it may be delivered in a way that is aversive to the dog. This failure in owner education and consistent application can undermine the effectiveness of the training and potentially lead to the dog experiencing stress or anxiety due to unpredictable outcomes. Ethically, a trainer has a responsibility to ensure the owner can implement the training plan effectively and humanely. Professional reasoning. Professionals should employ a decision-making framework that begins with a thorough assessment of the individual dog's temperament, motivations, and learning history. This assessment informs the selection of appropriate reward systems. The trainer must then consider the context of the training, the owner's capabilities, and the ethical guidelines of the profession. The decision-making process should prioritize positive reinforcement, the use of varied and appropriate reinforcers, and clear communication and education for the owner. This ensures that the training is effective, humane, and sustainable, promoting the welfare of the dog and a strong human-animal bond. Question 7. Risk assessment procedures indicate that a dog has a strong habit of barking excessively at the male carrier, a behavior that has been intermittently reinforced by the male carrier eventually leaving. The client desires to reduce this barking. Considering the principles of operant conditioning and the ethical guidelines for professional dog training, which approach is most likely to be effective and humane in modifying this behavior? Option A. Switch to a fixed interval schedule where the dog is rewarded only if it remains quiet for a specific duration before the male carrier arrives, ensuring it learns to anticipate the reward. Option B. Implement a continuous reinforcement schedule for the dog to remain quiet and settled when the male carrier is present, rewarding calm behavior every time it occurs, and gradually reintroducing intermittent reinforcement once the calm behavior is established. Option C. Immediately cease all reinforcement for barking and hope the behavior extinguishes quickly, as the male carrier no longer provides the reinforcement by leaving. Option D. Continue to reward the dog intermittently for barking at the male carrier, as this is the schedule it is accustomed to, while simultaneously trying to teach a new behavior. The correct answer is B. Implement a continuous reinforcement schedule for the dog to remain quiet and settled when the male carrier is present, rewarding calm behavior every time it occurs, and gradually reintroducing intermittent reinforcement once the calm behavior is established. Explanation. Scenario analysis. This scenario presents a common challenge in dog training where a client is seeking to modify a behavior that has become deeply ingrained due to intermittent reinforcement. The dog's behavior is maintained by a schedule that is unpredictable in its reward delivery, making it highly resistant to extinction. The professional dog trainer must navigate the client's expectations, the dog's learning history, and the ethical imperative to use humane and effective methods, all while adhering to the certified professional dog trainer knowledge assessed CPDTCA standards, which emphasize science-based, positive reinforcement techniques. The challenge lies in selecting a reinforcement schedule that will effectively reduce the unwanted behavior without causing undue stress or frustration to the dog or client. Correct approach analysis. The correct approach involves transitioning the dog from a variable reinforcement schedule to a continuous reinforcement schedule for the desired alternative behavior. This is crucial because continuous reinforcement, providing a reward every time the desired behavior occurs, makes the behavior more predictable and easier for the dog to learn and maintain. Once the desired behavior is reliably occurring, the trainer can then gradually reintroduce intermittent reinforcement, but in a controlled and systematic manner, to maintain the behavior's strength without over-rewarding. This aligns with the CPDTCA's emphasis on understanding learning theory and applying it effectively and ethically. The goal is to build a strong association between the desired behavior and reinforcement, making it more likely to occur than the previously reinforced unwanted behavior. Incorrect approaches analysis. One incorrect approach is to immediately attempt to extinguish the unwanted behavior by withholding all reinforcement. This is problematic because the dog has been operating on a variable schedule, meaning it expects reinforcement to appear eventually. Suddenly removing all reinforcement can lead to an extinction burst, where the unwanted behavior intensifies before it decreases, potentially causing distress to the dog and frustration for the client. This approach fails to acknowledge the dog's learning history and can be perceived as aversive. Another incorrect approach is to continue with a variable reinforcement schedule for the unwanted behavior while trying to introduce a new behavior. This is counterproductive because the variable schedule for the unwanted behavior will continue to maintain it, making it highly resistant to change. The dog will likely prioritize the intermittently reinforced unwanted behavior, as it has a strong history of being rewarded for it. This approach demonstrates a misunderstanding of how reinforcement schedules impact behavior. A third incorrect approach is to switch to a fixed ratio or fixed interval schedule for the desired behavior without considering the dog's current state. While these schedules can be useful, a sudden shift to a fixed schedule without proper shaping or chaining of the desired behavior might be too demanding for the dog, leading to errors and frustration. Furthermore, if the fixed schedule is too demanding, it could inadvertently reinforce the unwanted behavior if the dog resorts to it out of frustration. The CPDTCA emphasizes gradual progression and ensuring the dog's success. Professional reasoning. Professionals should first conduct a thorough assessment of the behavior, including its antecedents and consequences, to understand the current reinforcement schedule maintaining it. They should then educate the client about the principles of reinforcement schedules and the potential for extinction bursts. The strategy should involve identifying a desirable alternative behavior and implementing a continuous reinforcement schedule for that behavior. Once the alternative behavior is robust, a carefully planned, gradual reintroduction of intermittent reinforcement can be employed. This systematic approach ensures the dog's welfare, client satisfaction, and adherence to ethical training standards. Question 8. Market research demonstrates that clients often seek dog trainers with the expectation that all behavioral issues can be resolved solely through training techniques. When a client expresses concern that their dog's stubbornness or fearfulness is simply how they are bred, what is the most professionally responsible approach for a certified professional dog trainer to take? Option A. Acknowledge the potential influence of genetics on temperament. Explain that behavior is a complex interplay of genetics, environment, and learning, and recommend a veterinary consultation to rule out any underlying medical issues and discuss potential genetic predispositions. Option B. Reassure the client that with consistent application of the trainer's proven training methods, any genetic predispositions can be overcome, and focus exclusively on implementing the training plan. Option C. Agree with the client that the dog's behavior is primarily determined by its genetics and suggest that the client may need to adjust their expectations significantly without offering further assessment or intervention strategies. Option D. Inform the client that breed alone dictates temperament and that the trainer can only work with the dog's inherent genetic makeup, advising the client to seek a different trainer if they expect more. The correct answer is A. Acknowledge the potential influence of genetics on temperament. Explain that behavior is a complex interplay of genetics, environment, and learning, and recommend a veterinary consultation to rule out any underlying medical issues and discuss potential genetic predispositions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a trainer to balance client expectations with the scientific realities of canine behavior. Clients often seek quick fixes or attribute all behavioral issues to training methods, overlooking the significant role of genetics. A trainer must navigate this by providing accurate, evidence-based information without alienating the client or making definitive genetic diagnoses, which are outside their scope of practice. The certified professional dog trainer knowledge assessed exam emphasizes understanding the interplay of factors influencing behavior, including genetics, and the ethical responsibility to educate clients appropriately. Correct approach analysis. The correct approach represents best professional practice because it acknowledges the influence of genetics on temperament while clearly defining the trainer's role. It emphasizes observation, assessment of environmental factors, and collaboration with veterinary professionals for a holistic understanding of the dog. This aligns with ethical guidelines that promote evidence-based practice, client education, and appropriate referral when necessary. The trainer acts as an educator and facilitator, empowering the client with realistic expectations and a comprehensive plan. Incorrect approach is analysis. One incorrect approach fails by overemphasizing training methods as the sole determinant of behavior, dismissing the client's concerns about the dog's inherent nature. This is ethically problematic as it can lead to client frustration, ineffective training, and a failure to address potential underlying genetic predispositions that might require different management strategies or veterinary consultation. It also violates the principle of providing accurate, comprehensive information. Another incorrect approach is to make definitive statements about the dog's genetic makeup and its behavioral implications without proper veterinary or geneticist consultation. This oversteps the trainer's scope of practice, potentially leading to misdiagnosis, inappropriate training plans, and a breach of professional ethics by offering unqualified advice. It also fails to acknowledge the complex interaction between genetics and environment. A third incorrect approach involves solely focusing on the dog's breed as the sole predictor of temperament, ignoring individual variation and the influence of environment and training. While breed can offer general predispositions, it is not a deterministic factor for individual behavior. This approach is overly simplistic, potentially leading to inaccurate assessments and ineffective interventions, and can perpetuate breed stereotypes. Professional reasoning. Professionals should approach such situations by first actively listening to the client's concerns and observations. They should then conduct a thorough behavioral assessment, considering the dog's history, environment, and observable behaviors. The trainer's role is to educate the client about the multifactorial nature of behavior, including the role of genetics, learning, and environment. When genetic predispositions are suspected to be significantly impacting behavior, the professional ethical course of action is to recommend consultation with a veterinarian or a veterinary behaviorist who can provide a more definitive assessment and discuss potential genetic testing or management strategies. The trainer then collaborates with the client and veterinary professionals to develop a comprehensive, individualized behavior modification plan. Question 9. Implementation of a socialization plan for a young puppy with an unknown history requires careful consideration of potential risks. Which approach best balances the critical developmental window of socialization with the puppy's welfare and safety? Option A. Isolate the puppy completely until all vaccinations are administered, delaying all social exposures until that point. Option B. Rely solely on the owner's subjective assessment of the puppy's temperament and their comfort level with exposure to new situations. Option C. Immediately expose the puppy to a busy public park with many unfamiliar dogs and people to maximize exposure to diverse stimuli. Option D. Conduct a thorough risk assessment, consult with the veterinarian regarding health and vaccination status, and implement a gradual, controlled exposure to a variety of positive and age-appropriate stimuli in carefully selected environments. The correct answer is D. Conduct a thorough risk assessment, consult with the veterinarian regarding health and vaccination status, and implement a gradual, controlled exposure to a variety of positive and age-appropriate stimuli in carefully selected environments. Explanation. Scenario analysis. This scenario presents a common challenge for dog trainers, balancing the critical developmental window of the socialization period with the potential risks associated with exposure to novel stimuli, especially in a young puppy with an unknown history. The trainer must assess the individual puppy's temperament, the specific environment, and the potential for negative experiences, all while understanding the long-term implications of missed socialization opportunities. The challenge lies in making an informed decision that prioritizes the puppy's welfare and future behavioral health without exposing it to undue stress or danger. Correct approach analysis. The correct approach involves a thorough risk assessment that considers the puppy's individual temperament, health status, and the specific environment. This aligns with best professional practice by prioritizing the well-being of the animal. A responsible trainer would consult with the puppy's veterinarian to ensure it is medically cleared for exposure and to discuss any specific health concerns. They would then carefully select environments and interactions that are controlled, positive, and age-appropriate, gradually increasing the complexity and intensity of stimuli. This approach is ethically sound as it minimizes potential harm and maximizes the likelihood of positive outcomes, directly supporting the goal of producing a well-adjusted adult dog. While specific regulations for dog trainers are not universally codified in the same way as veterinary medicine, the ethical imperative to act in the best interest of the animal is paramount and implicitly guides professional conduct. Incorrect approaches analysis. One incorrect approach involves immediately exposing the puppy to a highly stimulating and unpredictable environment, such as a busy public park with many unfamiliar dogs and people, without any prior assessment or preparation. This fails to acknowledge the puppy's vulnerability during the socialization period and the potential for negative experiences to create lasting fear or anxiety. This approach is ethically irresponsible as it prioritizes a broad, potentially overwhelming, exposure over the individual needs and safety of the puppy, risking the development of behavioral issues. Another incorrect approach is to completely isolate the puppy until it has received all its vaccinations, thereby delaying any form of socialization beyond the critical window. While vaccination is crucial, this approach ignores the scientific understanding of critical developmental periods. Delaying socialization can lead to a fear-based response to novel stimuli later in life, making the dog more prone to fear, aggression, or anxiety. This is ethically problematic as it prioritizes a single aspect of care, vaccination, to the detriment of another equally critical aspect of the puppy's development, potentially leading to long-term welfare problems. A third incorrect approach is to rely solely on the owner's anecdotal observations of the puppy's temperament without conducting an independent assessment or consulting with a veterinarian. Owners may misinterpret a puppy's behavior, or the puppy may exhibit different behaviors in a professional setting. This approach lacks the necessary objectivity and expertise to make informed decisions about socialization, potentially leading to inappropriate exposures or missed opportunities, which is ethically questionable due to the lack of professional diligence. Professional reasoning. Professionals should approach socialization by first gathering comprehensive information about the puppy, including its health history from a veterinarian and any known background. This should be followed by an individual temperament assessment. Based on this information, a tailored socialization plan should be developed, prioritizing controlled, positive, and gradual exposure to a variety of sights, sounds, people, and other animals. The plan should be flexible, allowing for adjustments based on the puppy's responses. Regular communication with the owner and ongoing assessment of the puppy's progress are essential components of this process. Question 10. The monitoring system demonstrates that a client's dog, previously exhibiting mild reactivity on leash, has recently escalated to consistent, high-pitched barking and lunging at other dogs during walks, even at a distance. The client reports the dog also seems more hesitant to leave the house. The trainer's initial assessment suggests the dog's reactivity is rooted in underlying anxiety rather than aggression. Which of the following training approaches best aligns with positive reinforcement principles and ethical professional practice in this scenario? Option A. Suggest the client avoid all encounters with other dogs for the foreseeable future and focus solely on reinforcing calm behavior when the dog is alone in the house. Option B. Implement a desensitization and counter-conditioning protocol, gradually exposing the dog to other dogs at a distance where it remains calm, pairing the sight of other dogs with high-value treats and praise, while also working on building the dog's confidence in general through enrichment activities. Option C. Recommend the client practice heel commands more rigorously, using leash corrections whenever the dog shows any signs of tension or vocalization towards other dogs. Option D. Advise the client to immediately use a spray collar that releases citronella when the dog barks, to interrupt the behavior and deter future barking. The correct answer is B. Implement a desensitization and counter-conditioning protocol, gradually exposing the dog to other dogs at a distance where it remains calm, pairing the sight of other dogs with high-value treats and praise, while also working on building the dog's confidence in general through enrichment activities. Explanation. This scenario presents a common challenge in professional dog training, balancing the immediate need for a behavior change with the long-term ethical and effective application of positive reinforcement principles. The trainer must interpret subtle behavioral cues and understand the underlying motivations of the dog, rather than simply suppressing unwanted behaviors. The professional challenge lies in accurately assessing the dog's emotional state and learning history to select the most appropriate and humane intervention. The correct approach represents best professional practice because it prioritizes the dog's welfare and employs scientifically validated methods of positive reinforcement. By identifying the underlying anxiety and addressing it through counter-conditioning and desensitization, the trainer is not just masking a symptom, but resolving the root cause of the behavior. This aligns with the ethical guidelines of professional dog training organizations that emphasize humane treatment, avoidance of fear and pain, and the promotion of a positive human-animal bond. This method is also more sustainable, as it builds confidence and reduces the likelihood of the behavior recurring or manifesting in other ways. An incorrect approach that focuses solely on immediate suppression of the barking, without addressing the underlying anxiety, would be ethically problematic. Such an approach could inadvertently increase the dog's anxiety or fear, potentially leading to the development of more severe behavioral issues or even aggression. This would violate the principle of do no harm and fail to meet the standards of professional conduct that advocate for understanding and managing behavior through positive means. Another incorrect approach might involve using aversive stimuli to stop the barking. This is a direct violation of positive reinforcement principles and is considered unethical and potentially harmful, as it can create negative associations with the stimulus and damage the dog's trust in the handler. It also fails to address the emotional state of the dog, which is a core tenet of responsible training. The professional decision-making process for similar situations involves a thorough assessment of the dog's behavior, environment, and history. This includes observing body language, understanding the context in which the behavior occurs, and considering the dog's overall well-being. The trainer should then formulate a plan based on positive reinforcement principles, prioritizing methods that build a strong relationship and address the underlying emotional or motivational factors driving the behavior. Continuous monitoring and adjustment of the training plan based on the dog's response are crucial for ensuring effectiveness and ethical practice. Question 11. Risk assessment procedures indicate that a client's new puppy, a breed known for a strong heritable predisposition towards guarding behaviors, is exhibiting early signs of possessiveness over toys. The client is eager to prevent any future aggression and wants the puppy to be completely non-possessive. As a certified professional dog trainer, how should you best address this situation? Option A. Focus solely on the client's handling techniques, suggesting that any possessiveness is a direct result of their current interactions, and that correcting their handling will resolve the issue without needing to consider the puppy's genetic background. Option B. Explain to the client that while training can help manage and redirect possessive behaviors, completely eliminating a strongly heritable trait like guarding is often unrealistic. Propose a training plan focused on teaching impulse control, resource guarding prevention techniques, and positive reinforcement for sharing and calm behavior around valued items, setting achievable goals. Option C. Advise the client that since the breed has a strong guarding predisposition, it's likely the puppy will develop significant aggression issues, and suggest they consider rehomming the puppy to a more experienced owner. Option D. Assure the client that with intensive training, any puppy can be made completely non-possessive, regardless of breed predispositions, and outline a rigorous training regimen designed to suppress all possessive instincts. The correct answer is B. Explain to the client that while training can help manage and redirect possessive behaviors, completely eliminating a strongly heritable trait like guarding is often unrealistic. Propose a training plan focused on teaching impulse control, resource guarding prevention techniques, and positive reinforcement for sharing and calm behavior around valued items, setting achievable goals. Explanation. Scenario analysis. This scenario presents a professional challenge because it requires a dog trainer to balance the client's desire for a specific outcome with the inherent biological predispositions of the dog. The heritability of behavior traits means that certain behaviors are more likely to manifest in some dogs due to genetics, regardless of training. A trainer must ethically and effectively communicate this reality to a client without discouraging them or making unrealistic promises. The challenge lies in managing client expectations while adhering to professional standards and promoting the welfare of the animal. Correct approach analysis. The correct approach prioritizes a realistic assessment of the dog's potential based on its genetic background, and then develops a training plan that acknowledges these predispositions. This aligns with ethical best practices by avoiding misleading the client about the dog's capabilities and focusing on achievable goals that promote the dog's well-being and the human-animal bond. It demonstrates a commitment to evidence-based training and responsible practice, which are foundational to professional dog training. This approach respects the heritability of behavior traits by acknowledging that while training can modify behavior, it cannot fundamentally alter genetic predispositions. Incorrect approaches analysis. One incorrect approach involves promising to completely eliminate a behavior that is strongly heritable. This is ethically problematic as it sets unrealistic expectations for the client and the dog, potentially leading to frustration, disappointment, and even abandonment of the dog if the promised results are not achieved. It also disregards the scientific understanding of genetics and behavior, which is a failure of professional knowledge and integrity. Another incorrect approach is to dismiss the client's concerns entirely, attributing all behavioral issues solely to the owner's handling and ignoring the potential genetic component. This is dismissive and unprofessional, failing to acknowledge the complexity of behavior and the client's experience. It can damage the client-trainer relationship and prevent effective problem-solving. A third incorrect approach is to recommend drastic or aversive training methods to force the dog to suppress a genetically predisposed behavior. This is not only ethically questionable due to the potential for causing distress or harm to the dog, but also often ineffective in the long term for deeply ingrained traits. It prioritizes a superficial outcome over the dog's welfare and can lead to unintended negative behavioral consequences. Professional reasoning. Professionals should approach such situations by first conducting a thorough behavioral assessment, considering the dog's breed, lineage, if known, and observed behaviors. They should then engage in open and honest communication with the client explaining the concept of heritability and its implications for the specific behaviors in question. The focus should be on setting realistic goals, developing a humane and effective training plan that works with the dog's predispositions, and educating the client about responsible dog ownership and management strategies. This process ensures transparency, ethical practice, and the best possible outcome for both the dog and the owner. Question 12. Operational review demonstrates a dog consistently exhibits digging behavior in the garden when left unsupervised. The owner has tried verbal reprimands and a mild spray bottle of water, but the behavior persists. The trainer is considering implementing a more aversive consequence to deter the digging. Which of the following approaches best aligns with professional best practices for punishment in this scenario? Option A. Place a small, harmless but unpleasant tasting substance on the dog's paws that is activated by digging, hoping the taste will deter the behavior. Option B. Apply a sharp, loud noise directly to the dog's ears every time digging is observed, even when the owner is present, to create a strong negative association with the act. Option C. Increase the duration of the spray bottle application and add a stern, prolonged verbal scolding whenever the owner returns home and discovers evidence of digging. Option D. Introduce a remote-activated, ultrasonic device that emits a high-frequency sound when digging is detected, ensuring it is only active when the dog is unsupervised, and simultaneously teach the dog an alternative behavior like using a designated digging pit. Correct answer is D. Introduce a remote-activated, ultrasonic device that emits a high-frequency sound when digging is detected, ensuring it is only active when the dog is unsupervised, and simultaneously teach the dog an alternative behavior like using a designated digging pit. Explanation. Scenario analysis. This scenario presents a common challenge in dog training, addressing a behavior that is undesirable but potentially rooted in a dog's natural instincts or a lack of clear communication. The trainer must evaluate the effectiveness and ethical implications of different punishment strategies, ensuring they align with best practices and any applicable professional guidelines. The challenge lies in balancing behavior modification with the dog's welfare and avoiding unintended negative consequences. Correct approach analysis. The correct approach prioritizes understanding the underlying cause of the behavior and employing a punishment that is aversive enough to decrease the likelihood of the behavior without causing undue fear, anxiety, or pain. This aligns with the principle of least intrusive intervention, where the mildest effective consequence is used. Positive punishment, when applied correctly and judiciously, can be a tool to interrupt an unwanted behavior, but it must be paired with teaching an alternative desired behavior. The focus is on the asterisk function asterisk of the behavior and the asterisk impact asterisk of the punishment on the dog's emotional state and overall well-being. Professional guidelines often emphasize that punishment should only be used when other, more positive methods have been exhausted or are insufficient, and always with careful consideration of the dog's individual temperament and the context. Incorrect approach is analysis. One incorrect approach involves using a punishment that is excessively harsh or unpredictable. This can lead to the dog associating the punishment with the handler rather than the behavior, fostering fear, anxiety, and a breakdown of the human-animal bond. Such methods are ethically questionable and can be considered a failure to uphold professional standards of care and welfare. They may also violate guidelines that prohibit causing unnecessary suffering or distress to an animal. Another incorrect approach is to rely solely on punishment without addressing the underlying motivation for the behavior or teaching an alternative. This is often referred to as punishing the symptom, not the cause. It is ineffective in the long term as the dog may find other ways to express the same underlying need or drive. Ethically, this demonstrates a lack of comprehensive understanding of canine behavior and a failure to provide effective, sustainable training solutions. Professional standards require trainers to identify and address the root cause of behaviors. A third incorrect approach might involve using a punishment that is too mild to be effective. While this avoids causing harm, it also fails to modify the behavior, leading to frustration for both the dog and the owner. This can be seen as a failure to competently apply training principles and a waste of the client's resources. Professionally, it suggests a lack of understanding of the principles of operant conditioning and the necessary intensity of a consequence to influence behavior. Professional reasoning. Professionals should first conduct a thorough assessment to understand the function of the unwanted behavior. This involves observing the dog in various contexts and gathering information from the owner. Based on this assessment, they should consider a hierarchy of interventions, starting with positive reinforcement for desired behaviors and management strategies. If punishment is deemed necessary, it should be a positive punishment that is applied immediately following the behavior, is brief, and is of a sufficient intensity to be aversive but not harmful. Crucially, any punishment must be paired with teaching and reinforcing an incompatible, desired behavior. Professionals must continuously monitor the dog's response to ensure the punishment is effective and not causing distress, and be prepared to adjust their approach if necessary. Ethical considerations regarding animal welfare and the human-animal bond are paramount throughout the process. Question 13. Investigation of a client's dog, previously trained to stop barking at the doorbell through extinction, has begun barking again whenever the doorbell rings, despite the owner reporting consistent application of the original training plan. What is the most appropriate next step for the professional dog trainer? Option A. Immediately re-implement the extinction procedure for barking at the doorbell, assuming the owner's report of consistent application is inaccurate. Option B. Systematically observe the dog's environment and interactions to identify any potential antecedents or reinforcing consequences that may have re-emerged or changed, leading to the spontaneous recovery of the barking behavior. Option C. Conclude that the dog is inherently untrainable for this behavior and inform the owner that further professional intervention is futile. Option D. Advise the owner to use aversive techniques to immediately stop the barking, as the extinction protocol has clearly failed. Correct answer is B. Systematically observe the dog's environment and interactions to identify any potential antecedents or reinforcing consequences that may have re-emerged or changed, leading to the spontaneous recovery of the barking behavior. Explanation. Scenario analysis. This scenario presents a common challenge in dog training where a previously extinguished behavior resurfaces. The professional dog trainer must identify the underlying cause of this spontaneous recovery and implement an appropriate intervention strategy. The challenge lies in distinguishing between a true relapse due to reconditioning, an environmental trigger, or a misinterpretation of the behavior by the owner. Accurate assessment is crucial to avoid ineffective or even detrimental training methods. Correct approach analysis. The correct approach involves a systematic investigation to identify the antecedent or reinforcing event that has re-established the behavior. This aligns with the ethical and professional standards of the Certified Professional Dog Trainer Knowledge Assessed, which emphasizes evidence-based practices and understanding the principles of learning theory. By observing the dog's environment and interactions, the trainer can pinpoint what is currently maintaining the behavior, allowing for targeted intervention. This approach prioritizes the welfare of the animal by seeking to understand the root cause rather than simply suppressing the symptom. It reflects a commitment to effective and humane training, which is a cornerstone of professional practice. Incorrect approaches analysis. One incorrect approach involves immediately re-implementing the extinction procedure without investigating the cause of spontaneous recovery. This fails to address the underlying issue and is unlikely to be a long-term solution. Ethically, it could be considered a failure to provide competent service if the trainer does not adapt their strategy based on new information, the spontaneous recovery. Another incorrect approach is to assume the owner is not following the original plan and to simply re-instruct them without exploring other possibilities. This can damage the client-professional relationship and overlooks the possibility of environmental factors or subtle changes in the dog's behavior that the owner may not be aware of. A third incorrect approach is to introduce punishment-based methods to suppress the behavior. This is ethically unsound and often counterproductive, as it can lead to fear, anxiety, and other behavioral problems, violating the principles of positive reinforcement and humane treatment that are central to professional dog training. Professional reasoning. Professionals should approach spontaneous recovery by first acknowledging the phenomenon as a natural part of the learning process. The decision-making process should involve 1. Gathering detailed information from the owner about recent changes in the dog's environment, routine, and any perceived triggers. 2. Conducting direct observation of the dog in its typical environment to identify antecedents and consequences associated with the resurfaced behavior. 3. Analyzing the data collected to hypothesize the reason for spontaneous recovery, e.g., accidental reinforcement, a new cue, or a change in the dog's emotional state. 4. developing a revised intervention plan based on the identified cause, which may involve re-establishing extinction, modifying the environment, or introducing alternative behaviors. 5. Communicating the findings and the revised plan clearly to the owner, ensuring their understanding and cooperation. Question 14. What factors determine the most effective application of operant conditioning principles when training a dog to reliably respond to a cue in a distracting environment? Option A. The owner's desire for rapid results and the assumption that all dogs learn at the same pace with identical methods. Option B. The individual dog's motivation, the type and timing of reinforcement, and the gradual introduction of distractions. Option C. The trainer's personal preference for specific training techniques and the perceived intelligence of the dog. Option D. The immediate suppression of any incorrect behavior through aversive stimuli and the consistent use of a single, high-value reinforcer. The correct answer is B. The individual dog's motivation, the type and timing of reinforcement, and the gradual introduction of distractions. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the trainer to adapt operant conditioning principles to a live, unpredictable animal in a real-world environment, where external stimuli can significantly impact the effectiveness of training. The trainer must balance the theoretical application of reinforcement with the practical realities of a dog's emotional state and environmental distractions, ensuring the training is both effective and humane. Correct approach analysis. The correct approach prioritizes understanding the individual dog's motivation and the specific context of the training session. This aligns with best professional practice by emphasizing positive reinforcement and the systematic application of consequences based on the dog's behavior. It reflects an ethical commitment to the animal's welfare, ensuring that training methods are not only effective, but also minimize stress and fear. This approach is supported by the General Ethical Guidelines for Professional Dog Trainers, which advocate for science-based, humane methods that prioritize the dog's well-being and learning capacity. Incorrect approaches analysis. One incorrect approach might involve rigidly applying a single reinforcement schedule without considering the dog's progress or the environment. This fails to acknowledge that operant conditioning is dynamic and requires adaptation. Ethically, it could lead to frustration for the dog if the reinforcement is insufficient or to the dog becoming reliant on constant rewards, hindering independent problem-solving. It also disregards the principle of shaping behavior gradually. Another incorrect approach could be the indiscriminate use of punishment to suppress unwanted behaviors. This is a significant ethical failure, as it can create fear, anxiety, and aggression in the dog, damaging the human-animal bond and potentially violating guidelines that promote positive and humane training methods. It also fails to address the underlying reasons for the unwanted behavior, offering only a superficial solution. A third incorrect approach might be to assume that a particular reinforcer will work for all dogs in all situations. This overlooks the individual nature of motivation and the impact of competing stimuli. Ethically, it can lead to ineffective training and wasted effort, potentially causing distress to both the dog and the owner. It also fails to demonstrate a deep understanding of how to effectively apply operant conditioning principles. Professional reasoning. Professionals should approach training by first assessing the individual dog's temperament, motivation, and the specific learning environment. They should then select appropriate reinforcers and consequence strategies, starting with positive reinforcement and gradually introducing other principles as needed, always prioritizing the dog's welfare and the effectiveness of the training. Continuous observation and adjustment of the training plan based on the dog's responses are crucial. This systematic, ethical, and adaptable approach ensures that training is both successful and humane, adhering to the highest professional standards. Question 15. When evaluating a client's request to use a prong collar and leash corrections to quickly stop a dog from jumping on guests, what is the most ethically sound and professionally responsible course of action for a certified professional dog trainer? Option A. Suggest a brief trial of the prong collar and leash corrections to see if they are effective, with the understanding that if they don't work, other methods will be considered. Option B. Agree to use the prong collar and leash corrections as requested, as the client has expressed a clear preference, and the goal is to stop the unwanted behavior promptly. Option C. Recommend a combination of mild leash pops and verbal reprimands, as this approach is often seen as a balanced method that can be effective for managing jumping. Option D. Explain the potential negative side effects of prong collars and leash corrections, such as increased anxiety, fear, or aggression, and propose alternative, positive reinforcement-based strategies to manage the jumping behavior, focusing on teaching an incompatible behavior like sit or down when guests arrive. The correct answer is D. Explain the potential negative side effects of prong collars and leash corrections, such as increased anxiety, fear, or aggression, and propose alternative, positive reinforcement-based strategies to manage the jumping behavior, focusing on teaching an incompatible behavior like sit or down when guests arrive. Explanation: this scenario is professionally challenging because it requires the trainer to balance the immediate perceived effectiveness of aversive methods with the long-term welfare and ethical considerations mandated by professional standards. The Certified Professional Dog Trainer Knowledge Assessed exam emphasizes a commitment to humane and science-based training practices. The correct approach represents best professional practice because it prioritizes the dog's welfare, avoids potential for unintended negative consequences such as fear, anxiety, or aggression, and aligns with the ethical guidelines of professional dog training organizations that advocate for positive reinforcement and force-free methods. This approach is also more likely to build a strong, trusting relationship between the dog and owner, leading to more sustainable behavioral changes. An incorrect approach that relies solely on aversive methods fails to meet ethical obligations by potentially causing distress and harm to the animal. Such methods can violate principles of animal welfare, which are implicitly or explicitly covered by professional codes of conduct that all certified professionals are expected to uphold. Furthermore, using aversive techniques without a thorough understanding of their potential fallout can lead to a breakdown in the human-animal bond and create new, more complex behavioral issues, which is a failure in professional competence. Another incorrect approach might involve a haphazard combination of methods without a clear, systematic plan or understanding of how different stimuli interact. This can lead to confusion for the dog, unpredictable results, and a failure to address the root cause of the behavior. This demonstrates a lack of professional judgment and a failure to apply evidence-based training principles. The professional decision-making process for similar situations should involve a thorough assessment of the dog's behavior, environment, and the owner's capabilities. It requires a deep understanding of learning theory, prioritizing methods that are least likely to cause harm and most likely to build a positive relationship. Professionals should always seek to educate clients on the benefits of positive, force-free methods and explain the potential risks associated with aversive techniques, ensuring that the chosen training plan is both effective and humane. Question 16. The evaluation methodology shows a trainer observing a young Labrador retriever exhibiting persistent mouthing of hands during play. The trainer is considering how to interpret this behavior in the context of the breed's known characteristics and the puppy's developmental stage. Which of the following interpretations and subsequent actions best reflects a professional, evidence-based approach to breed-specific behavior assessment? Option A. The trainer documents the specific frequency, intensity, and context of the mouthing behavior, researches common mouthing behaviors in young Labrador retrievers, and develops a tailored plan with the client that includes redirection to appropriate chew toys and positive reinforcement for ceasing mouthing when asked, while also considering the puppy's individual temperament and socialization history. Option B. Recognizing that retrieving breeds like Labradors are naturally inclined to mouth objects and people, the trainer advises the client that this is normal puppy behavior that will likely subside with age and minimal intervention, focusing primarily on general puppy socialization. Option C. The trainer assumes the mouthing is a sign of aggression due to the breed's potential for strong prey drive and immediately recommends aversive training techniques to suppress the behavior, without further observation or consideration of alternative explanations. Option D. The trainer dismisses the mouthing as a minor issue, attributing it to the client's perceived inexperience, and suggests the client simply ignore the behavior, believing that any intervention will only reinforce it, regardless of breed tendencies or the puppy's learning capacity. The correct answer is B. Recognizing that retrieving breeds like Labradors are naturally inclined to mouth objects and people, the trainer advises the client that this is normal puppy behavior that will likely subside with age and minimal intervention, focusing primarily on general puppy socialization. Explanation: The evaluation methodology shows a scenario where a dog trainer is assessing a client's new puppy. The challenge lies in accurately interpreting the puppy's behavior without projecting human emotions or making assumptions based on limited experience. Breed-specific behaviors are a critical component of understanding a dog's natural predispositions, but they must be applied with nuance, recognizing individual variation and the impact of socialization and training. The correct approach represents best professional practice because it prioritizes observation, data collection, and a holistic understanding of the individual dog within its breed context. This aligns with the Certified Professional Dog Trainer Knowledge Assessed (CPDTCA) ethical guidelines, which emphasize evidence-based practices and client education. By focusing on observable behaviors and considering breed tendencies as a framework for understanding, rather than a definitive predictor, the trainer avoids misinterpretation and can develop a tailored, effective training plan. This approach respects the individuality of the animal and the client's goals, fostering a positive and productive training relationship. An incorrect approach that relies solely on anecdotal information or stereotypes about a breed would be a regulatory and ethical failure. This could lead to misdiagnosis of behavioral issues, inappropriate training interventions, and ultimately, a breakdown in the trainer-client relationship. For instance, labeling a behavior as just typical for the breed, without further investigation, dismisses the potential for underlying issues or the need for specific training, which could violate the principle of providing competent and effective services. Another incorrect approach might involve overgeneralizing breed traits to the point of ignoring the individual dog's temperament, socialization history, or environmental influences. This can lead to training plans that are ineffective or even detrimental, failing to meet the client's needs and potentially causing distress to the dog. Such a failure would contraindicate the CPDTCA's commitment to humane and science-based training methods. Professionals should employ a decision-making process that begins with thorough observation and information gathering from the client. This includes understanding the dog's history, environment, and the specific behaviors of concern. Next, they should consult reliable resources on breed-specific behaviors, but always as a guide to understanding potential predispositions, not as absolute determinants. The focus should then shift to assessing the individual dog's behavior in context, considering all contributing factors. Finally, the trainer should develop a training plan that is individualized, humane, and based on scientific principles, with clear communication and education for the client. Question 17. Benchmark analysis indicates that when employing negative reinforcement for a dog exhibiting leash reactivity, a trainer must carefully consider the intensity and duration of the aversive stimulus. Which of the following approaches best exemplifies the safe and ethical application of negative reinforcement in this context, prioritizing the dog's welfare and adhering to professional standards? Option A. Using a brief, mild leash tension that is immediately released the moment the dog redirects its attention to the handler, even for a fleeting second. Option B. Continuously applying moderate leash tension throughout the walk to prevent the dog from pulling ahead. Option C. Employing a sharp leash jerk only when the dog is actively barking at another dog, and maintaining the tension until the barking ceases. Option D. Applying a firm leash correction that is held until the dog stops lunging, with the intensity adjusted based on the dog's reaction. The correct answer is D. Applying a firm leash correction that is held until the dog stops lunging, with the intensity adjusted based on the dog's reaction. Explanation. Scenario analysis. This scenario presents a professional challenge because the trainer must balance the client's desire for rapid results with the ethical and regulatory imperative to prioritize the dog's welfare and avoid aversive methods that could be detrimental. The safe application of negative reinforcement requires a nuanced understanding of its potential for misuse and the importance of clear communication with the client regarding its limitations and risks. The trainer must also consider the specific learning history of the dog and its individual sensitivity. Correct approach analysis. The correct approach prioritizes the dog's welfare by ensuring the aversive stimulus is mild, brief, and immediately removed upon desired behavior. This aligns with the ethical guidelines of professional dog training organizations that advocate for humane and science-based methods. It also implicitly adheres to the spirit of regulations that aim to prevent animal cruelty or distress, even if not explicitly detailing specific training techniques. The focus on a clear contingency and the dog's ability to escape the stimulus are hallmarks of responsible negative reinforcement application. Incorrect approach is analysis. One incorrect approach involves using an aversive stimulus that is overly intense or prolonged. This constitutes a failure to apply negative reinforcement safely and ethically. Such an approach risks causing fear, anxiety, or pain to the dog, which could lead to behavioral fallout and potentially violate animal welfare regulations or ethical codes that prohibit causing unnecessary suffering. Another incorrect approach is failing to ensure the aversive stimulus is directly contingent on the undesired behavior, or that its removal is clearly linked to the desired behavior. This creates confusion for the dog, making the learning process ineffective and potentially increasing stress. Ethically, it represents a failure to provide clear and humane guidance, and from a regulatory perspective, it could be seen as a form of ineffective or potentially harmful training practice. A third incorrect approach is to continue using the aversive stimulus even when the dog shows clear signs of distress or avoidance. This demonstrates a disregard for the dog's emotional state and welfare, which is a direct ethical violation and could be interpreted as animal mistreatment under broader animal welfare legislation. Professional reasoning. Professionals must first assess the individual dog's temperament, history, and sensitivity. They should then consider if negative reinforcement is truly necessary and the most humane option for the specific behavior. If employed, the stimulus must be carefully selected to be as mild as possible, applied for the shortest duration necessary, and immediately withdrawn upon the desired response. Continuous monitoring of the dog's body language for signs of stress is paramount. Transparency with the client about the technique, its potential risks, and the importance of gradual progression is also crucial. If at any point the dog shows significant distress, the trainer must cease the application of negative reinforcement and reevaluate the training plan. Question 18. The efficiency study reveals that a client's dog exhibits persistent leash reactivity, and the client is requesting immediate suppression of the barking and lunging, suggesting the use of a quick-fix, aversive tool. The certified professional dog trainer must evaluate the most appropriate course of action based on established dog training theories and principles. Option A. Recommend a shock collar, explaining that the immediate discomfort will effectively suppress the barking and lunging, leading to a quieter and more manageable dog on walks. Option B. Recommend a comprehensive behavior modification plan that identifies triggers, employs desensitization and counter-conditioning, and focuses on building positive associations with the presence of other dogs and stimuli, while educating the client on the importance of humane, evidence-based techniques for long-term success. Option C. Advise the client to use a prong collar for immediate control during walks, as this will physically deter the dog from reacting and quickly stop the unwanted behavior. Option D. Suggest that the client ignore the behavior, believing that the dog will eventually stop reacting if it doesn't receive attention for it. The correct answer is B. Recommend a comprehensive behavior modification plan that identifies triggers, employs desensitization and counter-conditioning, and focuses on building positive associations with the presence of other dogs and stimuli, while educating the client on the importance of humane, evidence-based techniques for long-term success. Explanation. This scenario presents a professional challenge because it requires a dog trainer to balance the immediate perceived needs of a client with the long-term welfare and ethical considerations of the dog, all within the established professional standards for dog training. The trainer must critically evaluate the client's request against established learning theories and principles, ensuring that the proposed methods are not only effective, but also humane and scientifically sound, aligning with the professional code of conduct expected of a certified professional dog trainer. The correct approach represents best professional practice because it prioritizes evidence-based training methodologies that are rooted in positive reinforcement and a deep understanding of canine behavior and learning. This aligns with the ethical guidelines of the Certified Professional Dog Trainer Knowledge Assessed, which emphasize the welfare of the animal and the use of humane, science-based techniques. By focusing on understanding the underlying cause of the behavior and employing methods that build trust and a positive relationship, the trainer upholds the highest professional standards, ensuring the dog's well-being and promoting a sustainable, positive training outcome. An incorrect approach that relies solely on aversive techniques or punishment without considering the dog's emotional state or the potential for negative side effects would represent a significant regulatory and ethical failure. Such methods can lead to fear, anxiety, aggression, and a breakdown of the human-animal bond, directly contravening the principles of humane treatment and responsible training. Furthermore, failing to investigate the root cause of the behavior and instead applying a superficial fix demonstrates a lack of professional competence and a disregard for the dog's individual needs and learning history. This could also be seen as a failure to adhere to the spirit of professional conduct that prioritizes the dog's welfare above all else. The professional decision-making process for similar situations should involve a thorough assessment of the dog's behavior, including its context, triggers, and the dog's emotional state. This assessment should be followed by a review of scientifically supported training theories and principles relevant to the observed behavior. The trainer must then consider the client's goals and capabilities, proposing a training plan that is both effective and ethically sound, prioritizing humane methods and the dog's welfare. Open communication with the client about the rationale behind the chosen methods and the expected outcomes is crucial, ensuring transparency and collaborative goal setting. Question 19. The assessment process reveals a scenario where a dog, when gently tugged on its leash to prevent it from sniffing a discarded food item, stops sniffing and walks forward. The handler then releases the leash pressure. Which of the following best describes the operant conditioning principle at play? Option A. Positive punishment, as the leash tug is an unpleasant sensation intended to stop the sniffing. Option B. Negative reinforcement, as the leash pressure, an aversive stimulus, is removed following the desired behavior. Option C. Positive reinforcement, as the dog is rewarded for walking forward. Option D. Negative punishment, as the opportunity to sniff is removed. Correct answer is C. Positive reinforcement, as the dog is rewarded for walking forward. Explanation. The assessment process reveals a common challenge in dog training, distinguishing between the application of positive reinforcement and negative reinforcement, particularly when a dog's behavior changes in response to an aversive stimulus being removed. This distinction is crucial for ethical and effective training, aligning with the principles of animal welfare and professional conduct expected of a certified professional dog trainer. Misapplication can lead to unintended consequences, including fear, anxiety, and a breakdown of trust between the dog and handler. The correct approach involves accurately identifying that negative reinforcement occurs when an aversive stimulus is removed or avoided, thereby increasing the likelihood of the behavior that led to its removal. This aligns with professional best practices by promoting clear communication with the dog, fostering a predictable learning environment, and avoiding unnecessary stress or discomfort. Ethical guidelines for professional dog trainers emphasize using methods that are humane and scientifically sound, which includes a precise understanding of operant conditioning principles. An incorrect approach would be to misclassify the removal of an aversive stimulus as positive punishment or positive reinforcement. Misclassifying it as positive punishment would be an ethical failure because it implies adding an aversive stimulus to decrease behavior, which is not what is happening. Misclassifying it as positive reinforcement would be an ethical failure because it suggests adding a desirable stimulus to increase behavior, which is also incorrect in this context. Both misclassifications demonstrate a fundamental misunderstanding of operant conditioning, leading to potentially harmful training practices and a failure to uphold professional standards of knowledge and application. Professional decision-making in such situations requires a systematic analysis of the behavior, the antecedent, what happens before the behavior, and the consequence, what happens after the behavior. Professionals must ask, is something being added or removed? Is the behavior increasing or decreasing? By applying these questions rigorously, trainers can accurately identify the type of reinforcement or punishment at play and select the most appropriate and ethical training strategy. This analytical framework ensures that training interventions are based on sound scientific principles and prioritize the dog's well-being. Question 20. Cost-benefit analysis shows that implementing a comprehensive, positive reinforcement-based behavior modification plan for a dog exhibiting reactivity towards other dogs during walks, while requiring more initial time investment from the owner, yields significantly better long-term outcomes in terms of reduced stress for both dog and owner, and a lower likelihood of escalating behavioral issues compared to immediate, aversive correction techniques. Given this, what is the most ethically and professionally sound approach for a certified professional dog trainer to take when a client requests a quick fix for their dog's reactivity, expressing frustration and a desire for immediate suppression of the behavior? Option A. Advise the client that their expectations are unrealistic and that such behaviors are inherent to the breed, suggesting they simply avoid other dogs altogether without offering further training solutions. Option B. Educate the client on the principles of canine social behavior and the long-term benefits of positive, gradual desensitization and counter-conditioning, while developing a structured plan that addresses the root cause of the reactivity and manages the environment to prevent rehearsal of the unwanted behavior. Option C. Immediately implement a training protocol involving the use of a prong collar and leash corrections whenever the dog exhibits reactivity, as this is often perceived by owners as a direct and effective method for immediate behavior suppression. Option D. Recommend a muzzle for all outdoor excursions and suggest that the dog be kept on a very short leash at all times to physically prevent any interaction, without exploring the underlying behavioral or emotional components of the reactivity. The correct answer is B. Educate the client on the principles of canine social behavior and the long-term benefits of positive, gradual desensitization and counter-conditioning, while developing a structured plan that addresses the root cause of the reactivity and manages the environment to prevent rehearsal of the unwanted behavior. Explanation. Scenario analysis. This scenario presents a common implementation challenge for dog trainers. The trainer must balance the owner's desire for a quick fix with the ethical and scientifically backed understanding of canine social development. The challenge lies in the potential for misinterpretation of canine social cues, leading to ineffective or even harmful interventions. The owner's perception of dominance is a colloquialism that often masks a lack of understanding of actual social dynamics, creating a need for the trainer to educate and guide without alienating the client. Correct approach analysis. The correct approach prioritizes understanding the underlying social dynamics and addressing the root cause of the behavior. This aligns with best professional practice by focusing on positive reinforcement and desensitization/counter-conditioning techniques, which are widely accepted as humane and effective. This approach respects the dog's welfare, avoids punitive measures that can damage the human-animal bond and create fear or anxiety, and promotes long-term behavioral change. Ethically, it adheres to principles of minimizing harm and maximizing welfare. Regulatory frameworks for professional dog training, while not always explicitly codified in law in all jurisdictions, generally emphasize humane treatment and evidence-based methods. Incorrect approaches analysis. One incorrect approach involves immediately implementing a dominance-based correction. This is a significant regulatory and ethical failure. Such methods are widely discredited by modern ethology and behavior science. They can lead to increased fear, anxiety, aggression, and a breakdown of trust between the dog and owner. Ethically, it constitutes a failure to provide competent and humane care. It also risks violating any implicit or explicit professional codes of conduct that advocate for positive, force-free methods. Another incorrect approach is to simply dismiss the owner's concerns without offering a constructive alternative. This is a failure in client communication and professional responsibility. While the owner's terminology might be flawed, their underlying concern about their dog's behavior is valid and requires professional attention. Failing to address it, even with education, can lead to the owner seeking unqualified advice or resorting to harmful methods themselves. This represents a failure in client management and ethical duty of care. A third incorrect approach is to recommend aversive tools without a thorough assessment of the dog's individual temperament and the specific behavioral context. This is a regulatory and ethical failure because it bypasses the crucial step of understanding the why behind the behavior. Aversive tools can suppress behavior without addressing the underlying emotional state, potentially leading to more severe issues or unintended consequences. It also fails to meet the standard of care expected from a professional who should be employing the least intrusive, most effective methods. Professional reasoning. Professionals should approach such situations by first actively listening to the owner's concerns, acknowledging their perspective, and then gently reframing the issue using scientifically accurate terminology. A comprehensive behavioral assessment is paramount to identify the triggers and underlying motivations for the dog's behavior. Based on this assessment, a tailored, humane, and evidence-based training plan should be developed and clearly communicated to the owner, emphasizing the benefits of positive reinforcement and management strategies. Client education is a continuous process throughout the training journey.